Well, good evening, everyone, and thank you so much for joining us. I'm Sherry Wilson, and I'm the Executive Director for the Institute for Health and Social Equity. Our mission is to reduce health disparities by improving the health and social equity of vulnerable populations and underrepresented groups. Our focus is on motivating and inspiring historically underrepresented students who are interested in health and science careers, and for those who are already in the field by offering mentorship, education, and academic scholarships. Today marks the third episode of our Health and Science Career Series, where we interview unsung heroes. And these are individuals that we may come across on an everyday basis and may not otherwise know their stories. And we believe in lifting as we climb and passing on any knowledge that may help others so that they too may achieve. So just a few housekeeping notes before we get started. For our new supporters, thank you so much for joining us. And for those who have been with us since 2016, we were founded in 2016 as a nonprofit organization under the name the Wilson Initiative for Health and Social Equity. And earlier this year, to further align with our mission and our commitment to education. To that end, our website is under construction, and we're currently utilizing our Facebook page for future communications. Without further ado, I would like to introduce our guest for this evening in honor of Doctors Day. We have a very special guest who has made significant contributions to the field of medicine and the field of women's health.
Dr. Carla Cargill-Sandy is a board-certified obstetrician and gynecologist and a women's health expert. Dr. Sandy is a proud HBCU graduate of Oakwood University in Huntsville, Alabama. After graduating from Loma Linda University School of Medicine in Loma Linda, California, she relocated to Washington, D.C. for residency. Upon completing a 4-year residency in obstetrics and gynecology at MedStar Washington Hospital Center in Washington, D.C., she remained in Washington, D.C., where she joined a large medical group. In addition to working as an OBGYN, she has worked to globally improve women's health through advocacy on the Medical Society of the District of Columbia. As a member of the board of directors and a past president, Dr. Sandy testified before the DC Council on a myriad of issues to reduce healthcare disparities and improve access to care. Dr. Sandy is passionate about reducing healthcare disparities and maternal mortality, especially in communities of color. She is dedicated to her patients and has been voted a Washingtonian top doctor several times. Dr. Sandy enjoys her time outside the office too. She competes in triathlons to include swimming, biking, and running over the last several years and has competed locally in DC, Maryland, and internationally in Bermuda and St. Croix, U.S. Virgin Islands. She loves to travel and has made it to Europe, Africa, South America, Asia, North America, and the Caribbean.
Ladies and gentlemen, Dr. Carla Cargill-Sandy. Welcome, Dr. Sandy.
Thank you so much for having me. I'm so honored to be here today.
And thank you so much for joining us. I want to go ahead and jump right in and get started and ask you what inspired you or who inspired you to become a physician and why obstetrics and gynecology?
Wow, that's a great question. As long as I can remember, I wanted to be a physician. When I think back to when I was asked that question, what are you going to do when you grow up, even in elementary school? I wanted to be a doctor. And I think I was most inspired by my pediatrician. I grew up in Alabama in the 80s and 90s, and I had a Black male pediatrician. And he made quite an impression on me. And, you'd go there feeling sick. He'd do things and then you'd get better. I thought that was amazing. So I wanted to be a physician. And I grew up in an engineering town. Huntsville, Alabama is very much involved. There's a Space and Rocket Center there. NASA has a base there. So there's a lot of push for that type of thing. And I even did some engineering type internships in high school, but I was not dissuaded from becoming a physician. So The second part of your question about why obstetrics and gynecology, interestingly enough, when I went to medical school, my goal was to become a pediatrician. I wanted to take care of babies. And then I got to my third year of medical school and I did my first pediatric rotation, and I realized I didn't want to take care of babies. They didn't talk to me. They, they looked at me, cried. Their parents, were really part of being the patient too. And I was like, oh, this isn't for me. And I remember talking to one of my advisors, and they were like, but you're really passionate about taking care of women, about, getting the babies here. And I thought that would be a perfect fit for me. I would still be able to see the babies, but I wouldn't have to take care of them after they were born. So that drew me to women's health. And I'll honestly say, as I got more involved in women's health and women's health care, it is such an important part of, women's lives. Women are the backbone of society. They're caretakers, workers. They do so many things, and keeping them healthy so they can live fully realized lives is one of my goals.
Thank you so much. Dr. Sandy, as you were going through your academic career, even as a young child, and then through high school, and then ultimately deciding that you wanted to go to medical school, how did you know that you were operating within your gift? How did you know that this was something that you believed that you were good at, and that this was absolutely something that you were, it was a gift that you were operating in?
So I think that I was always, I would say, when I was in school, the sciences and those types of subjects, I really enjoyed them. I excelled at them. My teachers recognized that and encouraged me in those directions, put me in classes that were a little more challenging and that type of thing. And I had an affinity, to kind of STEM subjects, science, technology, engineering, and math. You'll often hear that referred to as STEM.
Yes.
And I really liked that type of stuff. And I was fortunate in having teachers to encourage that when they saw that in me, and also parents who saw that interest and helped to cultivate it. My parents were crucial in finding summer programs that would, augment the interest that I had, so I could explore different things while still being in high school. So I think with very supportive parents and also having teachers who took an interest in me, allowed that kind of natural affinity towards these subjects flourish.
Okay. Thank you. And did you have a mentor when you were growing up? And do you have a mentor now?
Oh, mentors. I love the subject of mentors. I think when I was growing up, now I grew up in a university town. I grew up around an HBCU, a historically Black college and university. My father taught at HBCU. And so I knew a lot of professors and, teachers and educators and people who worked in that environment. And so I think I had a ton of just unofficial mentors as I was growing up, folks who took an interest in what you were doing. I thought it was normal for people to just have PhDs and masters because I grew up in a university town, and that had a profound impact on me. I didn't come from a medical family, however. My parents are educators. They are immigrants. They immigrated to Jamaica from here. So I'm a first generation American. And as I decided to go into the medical field, I didn't necessarily have that mentorship about medicine itself. And I probably, in terms of figuring it out, I figured things out. But I definitely tell young people now, when they're thinking about going into medicine or any field really, find somebody who is in that field, who's already walked that path. There's no sense in breaking your own path when someone has made a path already and can help guide you through some of the pitfalls, that are there and that can be there. I definitely, by the time I started, I was in residency, training as an OBGYN, and I started working, definitely did have mentorship And, I think mentors can be both formal, they can be informal. A mentor is someone who, will listen to you, will talk to you, will correct you,
Mhm.
will provide feedback, constructive criticism, and, will guide you, in your career path and your choices. So yes, I still have mentors. I do believe that mentorship can start early, a lot earlier than we think of it, and
Yes.
that it's okay to, reach out to think about mentorship, to explore what you're interested in,
Mhm.
prior to, committing fully, so that you can see what's out there and what's available.
Mhm. Mhm. Did you experience any barriers throughout your academic or your career journey, and how did you overcome them?
I think that yes, the short answer is yes. I think they're definitely barriers. And it's interesting. It can come from a number of places. First, financial.
Mhm.
Finances can be very important as you're, going through and thinking about higher education. I mean, I was fortunate. I worked really hard in high school, and I was able to go to my undergrad on a full scholarship. And but medical school, I did have to take out loans. And so starting to think, figuring out how to pay for, how to, finance my education, it's like one of those
Yeah.
things that can be a barrier.
Mhm.
Medical school was hard. Medical school was really, really challenging. And I, when I went through high school and college, it wasn't that hard.
Mhm.
So
Right.
I could go to class, I could listen,
Yes.
read a
Yes.
little bit, and I did well, and it was great. And I
Yeah.
got to medical school and I ran into the wall of having to study, and I never really knew how to
Mhm.
study. And so that was
Mhm.
definitely a
Mhm.
barrier because my first set of grades were not reflective of what I was used to. And I had
Mhm.
to seek out advice, you know, um, find classmates who may have been doing better. I align, when are you studying? Can I come join you? And
Uh-huh.
figure it out. And so, that was definitely something, that could be, perceived as a barrier. I think when barriers show up, oftentimes you have to figure out how can I work around this? What can I do to
Mhm.
make it to my goal? I think there's also a challenge of being a woman in medicine.
Yes.
Medicine is a male dominated field. And even
Mhm.
though medical school classes over the last decade or so, there's more parity in terms of male and female, the split in the classes.
Mhm.
Medicine is a male dominated field.
Yes.
And
Yeah.
so having to navigate that as a woman,
Mhm.
it brings its own set of barriers. And, sometimes there are comments made, there are assumptions made about things like childbearing. You get asked questions that you're like,
Mhm.
should you be asking me that?
Right, right.
And and there are biases about the type of work that I would bring to the
Mhm.
table simply because I'm a woman.
Mhm.
And then, being a person of color, being a African American female, is, it's its own set of biases, that you often have to overcome, not just from, colleagues and people in the healthcare field, but also from patients who
Yes.
may look at you and make assumptions. You'll hear many female physicians, many physicians of color talk about being mistaken for the janitor, you know, the dietitian, anyone
Mhm.
else but the
Mhm.
physician.
Mhm.
And, you have to learn how to deal with that and how to say, how to gently correct, redirect, and say, actually, I'm Dr. Sandy and I'm here to see you today and to help take care of you,
Mhm.
So, yeah, definitely there are barriers there. But I think that, with planning, with perseverance, you definitely can overcome them to reach your goal.
That's great advice. Thank you so much, Dr. Sandy, because we do receive a lot of questions from students that are interested in going into medicine and
Mhm.
STEM fields in general. What can I do to prepare, or what can I do to succeed? while I'm in a medical program, medical school program. So thank you for that. That's very
Absolutely.
helpful. You touched on a few things, and one of the things that I wanted to talk about was diversity in the workforce and being, an African American physician, African American woman physician. But my question is, there's been a national focus, as you know, to increase the role of diversity in the medical profession, and COVID-19 has highlighted longstanding health disparities. How can creating a more diverse workforce of physicians help improve health outcomes?
That is a really good question. And I think that when you think about diversity, you're thinking about bringing um, thoughts, ideas to the table that
Hmm.
you may not think of yourself.
Hmm.
Because that's not your experience, your cultural experience, your worldview. And when we're not taking care of people that are exactly like us, that's the beauty of medicine. We're taking care of everyone. And so
Yes.
as we're planning treatment protocols, designing buildings, thinking of throughput, all kinds of things, you really need input from a diversity from physicians with diverse backgrounds in order
Hmm.
to achieve the best outcomes. When you look at the United States in particular, African American physicians make up about 5% of the physician workforce.
Hmm.
And when you talk about female African American physicians, we're about 2% of the workforce. So
Hmm.
African Americans in this country are about 12% or so of the population. So there's already a kind of disconnect between the availability of African American physicians and the kind of percentage of African American patients in the country. Um, when you look at different areas, and I'm an expert in women's healthcare, and there have been some recent studies that have looked at babies in the neonatal intensive care unit or the NICU who
Hmm.
are Black babies. And when they compared when they were cared for by physicians who were Black versus physicians who were not, and they found that the care actually improves. Now, the
Hmm.
study doesn't know why, it didn't go into why that was, but we can definitely draw some general conclusions from that. And a lot of times when we look at care and how it's delivered, it may not always be delivered in a culturally competent way. And secondly, bias plays a huge, huge, huge role in how
Yes.
that healthcare is actually delivered. So, a diverse workforce is extremely important in making sure that we're setting up protocols and procedures that actually reflect the population that we're taking care of.
Hmm.
Another example I like to give is studies. All the medications that we take and the surgeries that are recommended and the therapies that are recommended, a lot of those are evidence based and they come from studies. You
Right.
study a group of people and you who have, say, high blood pressure, and you say, okay, let's give them medicine A and medicine B. Okay, medicine B works better. And then recommendations are made that we should give medicine B to all our patient populations. But when you look at those study groups, they tend to be very homogenous and they tend to primarily focus on men, and they
Hmm.
tend to not have high numbers of people of color.
Hmm.
As a result, sometimes the therapies and recommendations that come out of those studies may not necessarily apply to
Right.
all communities, but we haven't looked at a diversity of communities when we were doing the study. So that's just another example where we can sometimes not fully care for someone because, when we came up with what made sense from our study, we didn't include everyone in the study. So diversity is extremely important, and it's something that improves care for all.
Thank you. Thank you, Dr. Sandy. So I've had the privilege of working with you for several years, learning from you, watching you
Oh,
grow professionally. And, as you've evolved throughout your career, you've taken an active role in advocacy for women's health issues. Can you share more about the work you've done to advance health equity for women?
Absolutely. So, in addition to direct patient care, I've been interested in how I can impact healthcare on a more kind of global level. And one of those ways I've gotten involved is through the Medical Society of the District of Columbia, or MSDC. And that is a group, the Medical Society of DC represents the physicians who are licensed and practice in the District of Columbia. And one of the things that I did through that organization is I would testify on behalf of physicians for bills that would come up before the DC Council, in bills that directly impacted women's health care and women's access to health care, women's access to contraception, treatment for certain conditions, improving access to mental health,
Mhm.
all of these types of things. And the legislative process is really interesting. And a lot of times, the bills that are introduced, they go through the process, they're voted on, they're codified into law. If physicians and healthcare providers are not involved in that process, we often get laws that don't make sense,
Mhm.
and we're like,
Mhm.
well, how did this happen? Well, nobody with a healthcare background was involved. And so I found it really important to take the time to learn the issues. I've testified before the DC Council, before several committees, in terms of supporting different bills that ultimately were signed into law to improve healthcare for the community, and
Mhm.
not just for the individual patient.
Thank you. And I remember you taking baby Calvin to the floor when you were there testifying um, with Mayor Gray at the time. And
Mhm.
one of the issues, and I believe we have a slide, is Black maternal mortality, and that you know Black women are dying at much higher rates in childbirth, than our white counterparts. And according to the CDC, yeah, here we go. Black women experience roughly 41.7 deaths per 100,000 live births on average, compared to 13.4
Mhm.
deaths for white mothers. And so I know that you've done a lot of work around advocacy for Black maternal mortality.
Yeah, and that's something that's very, very close to my heart. And when you talk about a country as rich and as varied as the United States of America, it really is. It's a shame that
Mhm.
simply by virtue of being a Black woman, irrespective of socioeconomic status, irrespective of educational level, irrespective of how much wealth, how celebrity or not,
Yes, educated,
it
whether you have
doesn't
yes.
matter, and I think that, the most recent example, it wasn't maternal mortality, but what we call maternal morbidity, when you have outcomes at the time of birth that are unfortunate, it was Serena Williams. And,
Mhm,
she talks very eloquently about the experiences she had after the delivery of her daughter and how she had to literally advocate from her hospital bed to get someone to listen to her when she's explaining, hey, these things are wrong. And she was being
mhm,
dismissed and her concerns were being dismissed.
mhm,
And so it's a big problem. And it's, I think it's a multifactorial problem. I think biases again play a big role. I think there's some structural racism in there that's also plays a big role in maternal mortality. I think one of the big myths is that women aren't compliant and Black women aren't doing what they're supposed to.
mhm,
I haven't met a patient yet that didn't care about
mhm,
their child
mhm,
and about their
mhm,
baby and about wanting to do what was best for their baby and wanting to get through their pregnancy, have a safe delivery so they could hold their baby. I have yet to
mhm,
meet a patient. Sometimes their ideas may be a little different from mine about how
mhm,
that can be accomplished. And again, diversity of thought is wonderful. But I haven't met anyone who truly was like, I'm just going to
Right.
completely disregard everything.
Exactly.
And so I think there's this fallacy that, sometimes these statistics are there because the woman is lacking somehow. And it's more that our system isn't designed to listen to respond to not dismiss the concerns that are being brought and being raised. And
Mhm.
by the time someone pays attention, it's often too late. And the disease processes have evolved to a point where now we're talking about serious outcomes, even to death. And so there's a lot of work to do. There's a lot of focus on this right now. I
Mhm.
think the COVID pandemic, unfortunately, hasn't helped any of this, because in the middle of all of this kind of pandemic we're having about Black maternal mortality, we now have what I call the loss of the advocates
Yes.
pandemic,
Yeah.
because
Mhm.
with the restrictions, and very rightfully so, that had to be put into place to prevent the spread of COVID-19. Suddenly you couldn't bring your partner, you couldn't bring your friend, you couldn't bring your advocate with you to your visits.
Mhm.
Suddenly you were limited in terms of delivery and that type of thing, like who could be there. And now you may be by yourself, in an exam room talking to your physician, and you don't have that person with you.
Mhm.
Advocacy, I think, is hugely important, and making sure when you're interacting with the healthcare system, you have someone there who's not you, who
Mhm.
can listen, who can absorb that information with you, who can ask the questions you may not want to ask, who
Mhm.
knows you, who could say, hey, doctor, hey,
Mhm.
healthcare provider, she may not be saying this, but the last 3 days she hasn't been able to sleep because she's in pain. You know,
Yes.
you need that person in the healthcare system. So
Mhm.
as the pandemic gets, hopefully soon gets better, and
Yes.
come out of it, I think that's one of the things that I strongly encourage women to do when they're interacting with the healthcare system, is making sure they have that advocate with them. It is critical.
Mhm. Agree. I just want to say that I wish we could clone you as a doctor. You just really you get it, and and it's a process. I understand, but we need more doctors like you, and this is evident in the fact that been voted top doctor, Washingtonian's top doctor, like 5 years in a row. So
Oh,
congratulations.
well, thank you very much. And I think too, having, I myself have been through the healthcare system. I myself received healthcare in the system.
Mhm,
I have two children, and I've
mhm.
had two babies, and it is it's humbling to be on the
Yes.
other side,
Yeah.
and with all my knowledge and with all my intellect, it all
Mhm,
went out my head when
mhm,
I was having my baby. And when my
mhm,
baby wasn't, I'm like, is he doing? I don't know. I don't know. I'm looking
mhm.
at him. Is he doing right? I have no idea. I wasn't thinking from, oh, Dr. Sandy, I was mother. And so I needed the
Yes,
advocate, who happened
yes.
to be my husband, who was like, hey, wait a minute,
Mhm,
this doesn't look right.
mhm.
Let's call somebody. Let's get someone involved, because, I was a mother
Yes,
first,
yes.
and so I think just interacting with the healthcare system myself and having received healthcare myself, shows me we still have a ways to go.
We really do. We really do. And we could talk about this like for the next couple hours. And this is a topic near and dear to the both of us.
Yeah.
But I do want to switch gears and ask you one more question before I open it up to anyone that has questions. HBCUs.
Oh,
I know. So we both went to HBCUs. I went to Hampton. You went to Oakwood. Um, has going to an HBCU helped you in your career, and how has it helped prepare you for where you are today?
so I am the biggest HBCU fan. HBCU, historically Black colleges and universities. I think they are fantastic institutions. I went to Oakwood University for 4 years in Huntsville, Alabama, which is an HBCU. when I say you walk on the campus and you are enveloped by your professors, by your teachers, by your the educators, by the people serving in the lunchroom, like everyone is looking out for you. It's the one time I could set down. I was truly comfortable. I didn't
Mhm.
have to worry about a lot of the pressures of, being a Black woman in America. I could just be, I could just learn. Your professors care so much that if you miss too much of something or too much class or something, people are looking for you.
Yes,
What's going
yes.
on? Where are you?
Mhm.
If you couldn't afford to go home for, Thanksgiving or Christmas, folks are saying, "Hey, you're going to be on campus. Let me have you over. Let me make sure you're fed." I mean, it's truly a family, and the connections that I made at when I was in undergrad, to this day, I can still go to any city, any town. You went to Oakwood? Oh my goodness. Yeah. I mean, and I know this happens over and over to people who went to any of our HBCUs. Sometimes I hear that they're like, well, what about the academics? What about I want to go to professional school. I want to, do X, Y, and Z. And it's almost like there's this I call it a false and limiting belief that an HBCU will hold you back from that. And I have
Mhm.
to go to a majority institution.
Mhm.
And that's not simply not the case, and in specifically to medical school, HBCUs are one of the biggest pipelines,
Mhm.
to preparing students to get into medical school and successfully matriculate through medical school. As of last year, we got HBCU grad who's vice president of the United States. I mean,
Yes.
no, we basically say no office or no area that you want to go in doesn't have an example for you from someone who's graduated from an HBCU. I think it's such a nurturing environment, and it's almost like a little bit of an oasis because the
Yes.
world is waiting for you. It's waiting for
Mhm.
you, and
Mhm.
once you step back out into the world, you're prepared.
Yes.
And you have all that has been poured into you to help sustain you as you go on to wherever you go from there. So big fan. I now get your education where you can.
That's right. Yeah.
Don't be
Mhm.
like, well, I didn't go to school because I didn't go to H. Mm-mm, I'm not saying that. But
Right.
what I'm saying is, if you do have that option and it's something that can work for you, by all means, take it.
Thank you so much. Um, I have a couple questions that came before the our broadcast, and the first question is, um, what are you most proud of?
Oh wow, what am I most proud of? I love that. I would have to say my family. I'm a real a family girl. And,
Hmm.
my husband and my kids, they're the ones that sustain me. They're the ones that, get me. They're excited when I come home.
Yes.
And I really am I'm proud to be a mom, to be a wife. My children are small right now. They're 4 and 6, but watching them grow and seeing like the little people they're turning into that is one of the proudest moments I would say that I've had. And so yeah, my family is what I would say for that.
Awesome. We have a question that came through Facebook. What barriers did you have to overcome when you graduated medical school?
So the way medicine is set up, you once you once you get into medical school and graduate from medical school, that's really just the beginning of the journey.
Hmm.
You do need to go through a residency um, training program, and residency training programs can range anywhere from 3 to 8 years, depending on the type of physician you want to be. And then sometimes there are further training programs after that called fellowships. They can be from anywhere from 1 to 4 years, depending on what type of fellowship it is. And I this is where that lack of mentorship when I was in medical school came in. I didn't know if I even understood how important it was to secure a resident physician position.
Mm-hmm.
And that's something you do your last year of medical school. There's a process called the match. You interview, you rank programs, they rank you, and a computer puts it together, and everyone finds out. It's in March. Match actually just happened about 2 weeks ago for all the medical students in the United States. And if you don't get a position, you suddenly you're in a place where you have to figure out what to do. What do you do for that year because you're graduating, and how do you recruit from that? So that is a barrier right there, just getting into resident physician training. And then resident physician training is tough. It's you don't make a lot. I think the highest I might have made in residency was 40 something thousand a year. And I was working really long hours. I was working 80 to 100 hours a week, and you're exhausted.
Yeah, yeah, yeah.
You may not be as social as you could have been. I couldn't go out to the club on Saturday night because I needed to sleep, and so that definitely, I remember finishing residency after 4 years and looking up and saying, wow, the world kept going while that training was happening. So the other barriers that you can have around medicine is that there's a lot of standardized tests and licensure that is required. And so in order to be licensed as a physician, you have to pass 3 parts of a national licensure exam called Step 1, Step 2, and Step 3. And then once you're licensed, most places do require you to become board certified in your specialty. And that is another set of exams. For me, I had to do a written exam and an oral exam to become a board certified OBGYN. So there's definitely, I think, with any career path that you have, there are definitely steps that can be a little treacherous. There are, you're supposed to go from here to here, but what if it doesn't work out that way? What if you don't get one of those steps? What if you fail one of those licensure exams? What do you do next? So there can be barriers. There are definitely ways over them. So, we never want to discourage you to the point where it knocks you off the path you want to go on. But I think when I first said I want to be a doctor, I really did think you go to medical school, you become a doctor. There's a whole lot. There was a whole lot to get there, and sometimes it's not presented to you in a way, and it's not presented to you in a place of support. So then you have to find your own support system and work it out.
Yeah. Thank you. We got another question. What is a fellowship?
Okay, so a fellowship is another years of training. So I'm going to give you an example from my specialty. After I finished, so I did 4 years of college, and then I did 4 years of medical school. And then because I wanted to be an obstetrician and gynecologist, which is a physician that takes care of women, I did 4 years of OBGYN training, residency. Now, if I wanted to train further, say I wanted to take care of women who have cancer, women's cancer, I would need to go to fellowship and do an additional 3 years of training so that I would now be a specialist in taking care of women who have cancer. So that's one example. Or if another example is, you may have heard people talk about high-risk doctors.
Yes.
So I'm a general OBGYN, which means I take care of women when they're pregnant, and I also take care of complex conditions if women have like diabetes and high blood pressure and different things while they're pregnant. But sometimes I need to refer my patient to a specialist who takes care of the extremely high-risk patients. Those specialists did a fellowship. So they did the 4 years of OBGYN training, and then they did another 3 years of training after that to specialize in that area of medicine. So a fellowship is just a fancy name for more training. That's really what it is.
Gotcha. Thank you, Dr. Sandy. Do we have any more questions? What risks did you take along your career journey?
What risks did I take? I think a couple things. First of all, I'm from Alabama. I went all the way to California to go to medical school. You know,
Yes.
I'll never forget my dentist who in Alabama, I saw him right before I went out and he's like, "You're going where? You're going to California?" Like California is another country. Like I don't understand. Why would you do that? But I've always been adventurous. As Dr. Sherry said earlier, I travel a lot. I like to see a lot of the world. So I thought it was a great opportunity to see another part of the country. California is very different from the South, the deep South that I grew up in. But it was, an experience that helped shape me and help shape the person that I am. When I was in medical school, I took the opportunity to do some missions and mission work. It may not even sound like a risk, but a lot of my classmates chose to do research and chose to work in labs, during the summer to strengthen their CVs and to strengthen their resumes so that they could be more competitive. And I wasn't interested in that. And I wanted to go help and to serve. And so I did a 4-week mission trip to India with a couple classmates. And we
Wow. How was that?
It was, it was an experience that I'm so glad that I had. And we were in the mountains, in the Himalayan mountains, at this little clinic that would get, a lot of the clinics would get cut off by the snow in the winters. We were there in the summer. The doctor did a lot of eye surgery. So I learned a lot about that. I learned a lot about being creative with limited resources. Another summer, I went to Kenya and spent about 3 weeks also working in a low resource hospital there. And it taught me a lot about recycling, reusing, so many things in the United States where I trained, which we considered one-use items. You use them, you throw them away.
Yes.
In a low resource setting, you can't do that. So I suddenly learned that a lot of single disposable things, single-use items were not, in actuality, could be used a lot. And I also learned how to diagnose and manage patients without depending on a lot of expensive diagnostic equipment. So I think if you think about it from a purely should I have done X, it would have been the safer option. But I took that risk because that's something inside me that I've always wanted to do. And even outside of training, I've taken the opportunity. I was able to go to Haiti after the earthquakes and help provide care, for about a week. A couple of years ago, I was able to go to Sierra Leone with a group of Black women physicians and help to train some of the resident physicians and students there who are going through training in maternal health. Sierra Leone has one of the highest maternal mortality in the world. And so, some of the smaller kind of interventions that we're so used to here, life-changing. And we were able to teach that. So, I think, as you're thinking about going through your career or even, going through college, don't be afraid to pursue your passions, even though it may not necessarily be it may not necessarily be the recommended thing to do.
Yes.
Those experiences have enriched me so much and taught me so much and made me a better and more compassionate physician than I ever could have become spending 4 weeks in a lab doing basic science research. Now, I'm not putting down working in a lab either. If that's your passion and that's what you want to do, by all means, pursue it and do it. But don't let fear hold you back, from kind of pursuing what you want to do, because those things help make you a well-rounded person. And well-rounded people are just frankly more interesting.
Absolutely. And I think that I believe that is really that sums it up. Don't let fear hold you back. We listen to you share, and thank you so much, your career journey, your challenges, your highs, your lows, and you didn't let fear hold you back. You took risks, and you continue to take risks throughout your career, and even in leadership. in a role where you are holding now. So I want to thank you so much, Dr. Sandy, for joining us. And I also want to share with the group that we do have scholarships available. We have scholarships for students interested in STEM, nursing, medicine, public health. Please inbox us at our Facebook page. Our website is under construction, but if you're interested, please inbox us and we'll be putting up some flyers. On that note, I want to thank you again, Dr. Sandy, for being our guest, and thank you everyone for joining us.
Thank you. It was my pleasure. Thank you so much for the opportunity.
Good night, everyone.